All right, thanks, Avery. This morning, we are opening the books on a couple of hospitals here in Austin.
There's a new federal rule requiring hospitals to be more transparent with their pricing, and some local nonprofit hospitals are apparently not following the rule like they should.
Deputy Policy Editor at OpenTheBooks.com, Rachel O'Brien, joins us now. Good morning, Rachel.
Good morning. Thanks for having me.
Well, Rachel, tell us what the federal pricing rule requires of hospitals and how the majority of hospitals, you say, are falling short.
Yeah, so the federal price transparency rule was enacted in January 2021, and it requires that hospitals post on their websites a price estimator tool where patients can search for specific services and get price estimates. Hospitals must also post a very detailed standard charges file for all the items and services provided by the hospital, including costs under each health insurance plan. So we worked with an organization called Patient Rights Advocate. They put together a very detailed analysis of hospitals all around the country, and they found that just under 25% of hospitals were in full compliance with these price transparency requirements. Most hospitals have some version of these things on their website, but they often don't have all of the details required. They don't have specific procedures, specific health insurance plans. Some are missing. They need to post the cash price, other versions of the prices. And so, as our CEO talked about last week on the show, this is important because the cost of healthcare is so high. About 100 million Americans have medical debt. So people should know what they're paying for.
Yeah, that's right. Rachel, which hospitals did you look at here in Austin, and what did you find?
So we looked at some of the largest nonprofits, St. David's Austin Medical Center, St. David's South. Together, they had exactly the same things, on their website. There were 10 components needed to have a complete and transparent pricing package. They were missing 5 out of the 10 components. So they have a price estimate tool, they have a standard charge file, but the file doesn't provide enough information. It has missing information, it's broad, there are inapplicable descriptions. In some places it has calculation instructions instead of actual prices. We also looked at Ascension Seton Medical Center. They're missing 2 out of the 10 pricing components, so not as bad. But again, they don't have a complete version of their standard charge file. So there's still work to be done to get a complete picture for what procedures cost.
So Rachel, what did the hospitals have to say about the findings that their tools are inadequate?
So spokespeople for both the hospital systems to get back to us, they pointed to their price estimator tools on their website. They are complying with that and the standard charge file that patients can review. When we brought up that they're not complete, they both pointed to the Centers for Medicare and Medicaid Services. They oversee this federal rule. And CMS has only fined 2 hospitals in Georgia for not complying. So a lot of hospitals will point to this and say, we're not on this list. There's only 2 other hospitals on this list. But CMS hasn't been aggressive about going after hospitals that are not complying. They've only fined these 2. And the Inspector General of the Department of Health and Human Services is actually investigating whether CMS is doing its job in monitoring and enforcing this rule.
All right, Rachel, thank you so much for chatting with us this morning.
Thank you.
For more information about this investigation, go to OpenTheBooks.com.